Hi everyone, I'm Dr. Vipul Shah, Clinical Director here at PAC Health. We're here today for our weekly COVID-19 update. We're going to change formats a little bit from our last couple of weeks, and we're going to take questions that have come directly from you. So we're just going to go ahead and get started. All right, so the first question, how does it spread and how can I avoid getting it? All right, so how does it spread? We know that the coronavirus is spread via droplets when somebody who has COVID-19 sneezes or coughs. So those droplets can then travel to someone who doesn't have it and then infect them. Other ways that it can be transmitted, we know, are close contact from someone who has it, but may not be showing symptoms. So that's what they call the asymptomatic spread of this. Other ways that it may be spread are from contaminated surfaces, which means that somebody who has COVID-19 sneezes and then touches something, and then that surface isn't cleaned, and then if you touch that surface and then touch your face, you still could get it. We don't know how long the coronavirus actually lives on some of these surfaces or how infectious it is when it is on that surface, but it really does behoove all of us to be careful about that. So how do you avoid getting it? Now, that's probably the biggest question on everybody's mind. Main thing is the social distancing, and that means staying away from large groups and maintaining a 6 feet distance from people around you. Also avoiding people who are sick or who are visibly sick. So people who are coughing or sneezing, you want to stay at least 6 feet away from. And if you know somebody who has COVID-19, really allowing them to fully socially isolate is very important. That doesn't mean abandoning them or leaving them to their own devices, but understanding that all of us have to protect ourselves and figuring out ways to stay safe in that, in that situation. Also, washing your hands regularly. That's super important, so making sure that you wash your hands for that 20 seconds, figure out whatever song you need to figure out, and use the right type of soap or alcohol-based hand sanitizer to make sure that you're getting in all those crevices and really paying attention to your hands, especially before you touch your face or your eyes or after you've touched any sort of surface. And then this is not so much how you avoid getting it, but how can you help everybody else around you avoid getting sick. And so this is common courtesy sort of things. You know, if you're going to sneeze, make sure you sneeze into your elbow, or if you cough into your elbow. If you do end up coughing into a Kleenex or something like that, or into your hand, making sure you throw that away immediately, or if you cough into your hand, making sure you wash your hands immediately before touching any of these surfaces. Because like I said before, we know that coronavirus can live on some of these surfaces, and if they're not cleaned, that can be a way that it's transmitted. Should I continue to stay indoors? And then how do I manage my stress? So do I need to stay indoors? I think that's a hard question right now, and it really depends upon where you are. Some places may ask you to stay indoors for most of the day, and that's because of the way that they're very densely populated or the way that they see that the virus is spreading. So make sure you're following the advice of your public health officials. But if you are able to go outside, that is an important thing to help you manage your stress. So finding ways that you can maintain social distancing, so keeping 6 feet away from people, making sure that if you do go out that you're washing your hands before you touch your face, all of those sort of things still apply when you go outside. So if you're going to do that, just make sure you follow those rules. In terms of managing stress, that's going to be something that we're all dealing with right now. It's a really stressful time. There's a lot of uncertainty in a lot of different arenas. So I think everyone understands that we're all under a lot of stress. PAChealth.com has a lot of resources, so make sure that if you get a chance, go to our website and look at some of those resources for ideas on how to manage stress. Some of the things that I would think that are important are, making sure that you do get outside and exercise if you can. Even if you can't get outside, exercising in your house so that you're getting some physical activity. And then understanding that social distancing does not mean socially isolating yourself. You still can communicate with all the digital tools that we have. So if you have friends or family that you would normally see in person, try to figure out a way to talk to them, whether it's on the phone or some of the video apps that are out there like FaceTime or Google Hangouts, anything you can do to try to stay connected to people. Also, making sure that you're not getting too wrapped up in the coronavirus stuff to not be taking care of your hobbies or taking care of yourself, making sure that you're taking care of your chronic health disease issues. That's an important thing. And then one of the things that I would recommend all of us do to help with this is give yourself a break. This news is somewhat overwhelming and it's kind of constant. So turning off your phone and turning off the news for a little bit and trying to get away from it might be really helpful. All right, on to the third question. When should I get tested and how do I get a test? So when you should get tested really depends upon whether you're showing symptoms, and some of this also depends upon whether the area that you're in has enough tests. Unfortunately, here in the United States right now, we don't have enough tests for everybody. And so there may be certain restrictions on whether you can be tested depending upon where you live. If you do start having symptoms, meaning fevers, cough, muscle aches, things like that, try to call your doctor first. Don't just go to get tested. They may recommend that you just stay home, because if you have mild enough symptoms, the main thing that they're going to recommend is just staying home as much as you can and avoiding any contact. In terms of how do you get a test, that kind of goes along with where you are as well. Some places have drive-through testing available. Other places you have to go to a doctor's office or to the hospital. It really just depends upon where you are. If you do feel like you need to be tested and your doctor has recommended that you get a test, just talk to them about some of your options. The next question, is there a vaccine, a medication, or treatment for COVID-19? So in terms of a vaccine, no, there is not a vaccine at this time. Vaccines generally take about a year to 18 months to be fully developed. So I wouldn't be expecting a vaccine for at least another year at this point. In terms of medications or treatments for COVID-19, a specific medication doesn't exist for COVID-19. There are certain medications that are being trialed right now, and people who have very severe disease or are hospitalized with COVID-19 may be getting some of these treatments. But I would caution everybody to really take with a grain of salt what you're hearing in the news media and on blog posts until some of this really bears out from the medical evidence. In terms of treatment, that really depends upon how severe the symptoms are. So if you have a fever, you can take Tylenol. There was some concern about ibuprofen at one point, but the WHO has taken away that recommendation against ibuprofen. So at this point, it is safe to take both ibuprofen and Tylenol. Other medications or treatments that are more supportive in terms of if you're in the hospital, you may end up needing oxygen if you're in the hospital, or people who get really sick may end up on a ventilator. So I think these are all things that are out there as treatments, but they're not specific to COVID-19 at this time. And now for our last question. I have a chronic condition. What does this mean for me? And this is a really important question. So if you have certain chronic conditions like high blood pressure, diabetes, certain lung diseases like COPD or asthma, or heart disease, you could be at a higher risk for more severe disease from COVID-19. So what that means is that you need to be extra careful about some of those precautions we were talking about earlier. Really staying out of social gatherings and trying to stay home as much as possible is important. Also making sure you wash your hands. And if anyone else that you know is sick, really avoiding contact with them completely right now. We just want to make sure you stay as safe as possible. In terms of managing your chronic disease, you need to do all those things that you're already doing. Managing your blood pressure, managing your blood glucose levels, making sure that you're exercising if you can. Those are all things that are going to be important. Eating healthy, all of those are still important. So managing your chronic conditions are just as important during this time. So if you need any help with that, make sure you talk to your health advisors. And finally, you may end up finding that your regular doctor's visits are either canceled or rescheduled as telehealth visits. If you have any questions about that, reach out to your health advisor and we can give you some tips to make sure that you get the most out of those options. Well, that wraps up our first question and answer session here in the Pack Health Studios. Remember, our health advisors are a resource for you if you need any help getting groceries or your medications, or if you just have any questions and need to reach out to somebody. We can also help you with meal plans as well as exercise routines while you're at home. The team here at Pack Health has put together plenty of COVID-19 resources, so go to packhealth.com and keep checking back regularly. We're going to update our blog regularly, so we really hope that these posts are helpful to you, and please, if you have any suggestions, let us know. We're here to help, and if you have any questions, like I said, ask your health advisor, and we'll see you next week.